Turn it over to you. Good morning, everybody. Start off with the safety and the security of the Rochester General Hospital employees, their patients, and their families is of the utmost priority to the Rochester Police Department. This morning, just after 1 a.m., the FBI alerted the Rochester Police Department of a live stream video of a suicidal male in the Rochester area. The information received at the time was indicative of a possible threat towards Rochester General Hospital and a list of their employees. We immediately contacted our partners at Rochester General Hospital, who placed the hospital in a lockdown status. Additionally, to ensure the safety of all, we provided an increased presence at the hospital campus. Investigators began to review the hours-long video and determined that the male in question was making suicidal comments and did not make any direct threats towards Rochester General Hospital. Working through our law enforcement partners, we were able to identify the male in the video and his location at a residence in East Rochester. Law enforcement responded to the address and ultimately located the male, and we believe him to be deceased inside the residence. Time and time again, we speak about the coordination between the RPD and our partner agencies. This incident is a prime example of bringing together our law enforcement and civilian partners and identifying a potential threat and then responding accordingly. Moving forward, we will continue to work with Rochester General Hospital in coordinating safety plans to ensure continued safe outcomes at their facilities. Thankfully, no danger was ever present at Rochester General Hospital, and all of their employees, patients, and their families are safe. I'm going to turn it over to Dr. Mayo from Rochester General Hospital.
Thank you, Lieutenant Bello. I am Dr. Robert Mayo. I'm the Chief Medical Officer for Rochester Regional Health. I'd like to start by expressing the deepest sentiment of gratitude and appreciation to Lieutenant Bello and his entire police force, who came immediately to the assistance of Rochester General Hospital and in their organized and professional manner ensured that our site was safe and secure. The coordination that was exhibited between federal law enforcement, local law enforcement, and our facility security team has been exemplary and really stands as a testament to their preparation and to the commitment that they all have to keeping this community safe. The team members and employees here at Rochester General Hospital took many quick actions, thinking quickly to ensure that they and their patients were safe. And the leadership team came early in the morning to begin incident command proceedings to ensure that we were coordinated as a leadership team with consistent communication and coordinated actions. This really is a great example of the commitment and the teamwork that lives here in this community and in this institution. We are relieved and grateful to know that the community is safe, and we'll do our utmost to support our employees as they emotionally go through this experience. We all know that traumatic events like this require time to process, and they may require assistance of others to think through, talk through that processing, emotional, and debriefing experience. So these resources are available to employees at Rochester General Hospital and throughout Rochester Regional Health. So I'd like to, again, thank our employees for their tremendous service, the dedication which they exhibit every day, and for the partnership that we are so grateful for from our Rochester Police Department.
This point, we'll take a few questions as well.
Dr. Mayo, is the hospital still under lockdown?
I'll repeat the question. The question is the hospital still under lockdown? No, the lockdown was ended around 9:30 this morning after the leadership of RPD confirmed that the external threat was completely resolved, and so we are back to full operations.
Dr. Mayo, how do you lock down a hospital, and how does that impact patients and staff?
Sure, the question is, how do you lock down a hospital? And this is a very big facility with many entrances. Well, there are multiple steps, and there is a checklist of actions that are put into place, but fundamentally, we secure all the entrances, either through locking them or having posted security guards or police officers, in this case this morning. And then we also then take immediate stock about who we are expecting would be entering or exiting the building, whether it's a shift time for employees, and in this case we delayed night shift departures so that there would be fewer people passing through entrances. We also, based on the assessment of the police department, made a decision that patient care could continue, and so we did provide continuing care for scheduled as well as potentially emergency patients. But in a lockdown situation, you would make assessments of that kind. But this lockdown did not interrupt patient care.
Dr. Mayo, about how many ambulances were diverted to other medical facilities, and who took the brunt, or not the brunt, I should say, but who took them in?
The question is how many ambulances were diverted. I don't know. I don't know the answer to that question. We work daily with our EMS partners. The University of Rochester Medical Center leadership and I communicate whenever there is a situation that would require any diversion of care, so that we are working in tandem to provide care for the community.
Lieutenant Bello, if you could speak on the nature of the social media threat, when that was discovered, you said it was a lengthy live stream.
Correct. So it was just after 1 a.m. that we were alerted by the FBI of the live stream. When we ultimately were able to view the video and get it off of social media, it was several hours in length, which what brought us into this well into the morning was the amount of time it took to review that video, to look for any evidence, try to figure out who the person was, locate that person, etc. So it was a lengthy video that did take time to process through.
So was that live streaming as while you were watching it? Is that how did you coordinate that, and what were the challenges there?
So we were sent the video by the FBI and the live streaming link, because obviously once those videos start to go, they get taken down by social media, etc. So I can't get into the specifics of the capturing of that video, but it was sent to us, and it was in coordination with the FBI.
So it was happening live as it was sent to you, or was it?
The FBI was watching it live and sent it and made us aware of what was going on with it.
Was this suspect on your radar before this, or was this just
So I'm not going to get any specifics of who we monitor, who we don't monitor, or who the FBI monitors or doesn't. That's something we don't like to talk about our tactics and some of our techniques of how we do things. So in this case, really what I'd like to emphasize is that our federal partners, so we talk all the time. We get together, we have these press conferences, you guys, we talk all the time about our coordination, our cooperation between our different partners. So in this case, we say federal, state, local. In this case, it started at the federal level and worked its way to a local level. So the federal authorities alerted us to this potential, and then you look locally. So beyond RPD here at RGH, this ultimately led to an ongoing investigation out in East Rochester right now. So that partnership with both the East Rochester Police Department and the Monroe County Sheriff's Office, right? It's all of these agencies that are working together, and then in this case, it brought together a civilian partnership as well with Rochester General Hospital, working all together to bring these events to a safe conclusion. So at the same time, it is still ongoing out in East Rochester. They're still investigating. The Sheriff's Office and East Rochester Police Department are still actively working a scene out in East Rochester associated with it. The point that we're talking about now, the cooperation from the Rochester Police Department side with all of our partners, we'd like to thank them, that allows things like this to go so smoothly. We put these plans in place, we coordinate with these different agencies, so something like this, something significant of a potential threat here at a giant hospital facility, the response went smoothly, which led to locating this person, which ultimately led to keeping everybody here at the hospital safe. We can't control what somebody does out in their own life or out in East Rochester, but we can control is what occurred here, which was keeping this campus safe. So as that investigation continues, we'll work towards what those partnerships, what occurred within them, and then we always reevaluate, we always debrief after them, and figure out also what we could have done better and what we can do better. But we can't do that because the scene out in East Rochester is still very, very active. And we'd like to thank our partners for continuing the investigation out there, that obviously being the East Rochester Police Department and the Monroe County Sheriff's Department.
Is the person a fellow, an ex-employee or an ex-patient?
So I'm not going to get into anything in terms of identifying the individual at this point, because again, it's still an active scene, and also I'm going to say who we believe. We believe him to be deceased inside the scene. We have not made entry into the residence at this point. We're still working our way through that, and that's going to be a question that's going to be answered later on by the East Rochester Police Department and or the Monroe County Sheriff's Department.
And you said you targeted specific people at times?
There were some specific people that he mentioned within his live streaming, yes. And so in terms of an association or a relationship, that's what we're still working towards. So this only began a few hours ago as our pouring through those videos. That's all stuff as we continue to work our way through those videos, and as our investigators continue to work through any sort of association between those staff members and this person, then we'll be able to identify that and work through it later on.
Dr. Mayo, I believe you may have touched on this before, but if you could just reiterate, what's your response to the social media posts and the contents on the social media?
Well, our response was fully coordinated with the RPD, and their expertise, leads us through that process. And we reach out with supportive interventions here with our team members and employees, and so they had the resources that they need, and we're grateful that the external threat is no longer in existence.
Lieutenant,
So-
go ahead.
Yep, one more. Go ahead.
I was going to ask, there's already a security team here. Will RPD still maintain a presence here today?
Yes, it's part of our anytime to help employees, help staff, help family members, help patients here. We'll continue an increased presence throughout the coming days, just to ensure that everybody feels comfortable at their work. I mean, this is a hospital. This is where people come for a safe zone, right? Medical conditions, mental health conditions, all of those, that people come here to be safe and to be safe with their families. So we're going to be working with RGH Security over the coming days to evaluate what our presence has been and what we can do to increase our presence as well, or adjust our presence to make sure that everybody feels safe within their environment of what should be ultimately the safest zone in Rochester. So any questions, we'll be briefing the media later in the day once the East Rochester scene is resolved. And that'll come through the East Rochester Police Department and the Sheriff's Department. So thank you everybody for coming. I appreciate everything that you folks do and getting this message out to our community that things have been resolved here at Rochester General and that Rochester General is open and safely moving forward throughout the day. Thanks everybody.